This is the SchoolCare 65 Plus benefit presentation for retirees. This presentation covers Medicare basics and details for the SchoolCare health plan options. You have many options for Medicare supplement plans, so we'd like to review a few reasons why you might choose SchoolCare 65 Plus. We'll then review the next steps for enrollment and, as always, your SchoolCare resources. Medicare is a federal health insurance program administered by the Centers for Medicare and Medicaid Services, or CMS. It is made up of 4 parts: A, B, C, and D. Medicare has its own eligibility you must meet to qualify. You need to be 65 years old, or you qualify based on disability or other special situation, and you are a U.S. citizen or legal resident who has lived in the United States for at least 5 consecutive years. Medicare has 3 enrollment periods. The first is your initial enrollment period, or IEP. This is made up of the 3 months prior to your 65th birth month, your birth month, and the 3 months after your birth month. There are no penalties if you enroll during this time. The next period is called the Special Enrollment Period, or SEP. This is for people who are over the age of 65, but who are still covered under an employer-sponsored plan. This period runs for 8 months after the termination of your benefits due to retirement. There are also no penalties for enrolling during this time. Please note, if you or your spouse are under the age of 65, you will remain enrolled in the SchoolCare Cigna plan until age 65 or Medicare eligible. The third period for enrollment is called the General Enrollment Period, or GEP. This period runs annually from January 1st through March 31st and is for individuals who are not eligible for either an IEP or SEP. Coverage would begin the first of the month following the enrollment date. There are a few potential penalties you may incur if you do not enroll at the correct time. There is a 10% penalty imposed for each year an individual was eligible for Medicare Part B, but was not insured under any plan. Also, there is a 1% penalty of the national base beneficiary premium imposed for each month an individual was eligible for Medicare Part D, but was not insured under any plan. This is referred to as the late enrollment penalty. When eligible, you first need to enroll what is considered Original Medicare, made up of Parts A and B. Part A helps pay for hospital stays and inpatient care. Part B helps pay for doctor's visits and outpatient care. Part A has no premium cost to the participant, and Part B's standard premium for 2025 is $185 per person per month. This could be higher due to your income. The expenses that you may incur under both Parts A and B include the following. There is a $1,676 Part A deductible for 2025 that you could incur per benefit period when admitted into the hospital. For any hospital stays longer than 60 days, you also would pay $419 per day from days 61 through 90. and $838 per day after day 90. There is a $257 deductible for Part B for 2025, and you also pay 20% for any medical costs after you reach that deductible. There is no coverage outside of the United States under Medicare, so you would pay all costs for care outside of the United States. In addition, Medicare does not provide self-administered prescription drug coverage. Now that you understand the deductibles and coinsurance under Medicare Parts A and B, the next step is to choose coverage to fill in those gaps. The first option would be to choose a Medicare Advantage plan, also known as Part C. These plans are offered by private companies and combine Part A and B into one plan. It usually covers Part D as well, for prescription drug coverage. Medicare Advantage plans also provide additional benefits and services not covered by Original Medicare. Your second option would be to enroll in both a supplement plan and a Medicare Part D plan. Both supplements and Part D plans are offered by private companies. Supplement plans help pay for some of your out-of-pocket costs associated with original Medicare, and Part D plans help pay for your prescription drugs. This brings us to the SchoolCare 65 Plus Retiree Health Plan offerings. First, we present our custom-designed group SchoolCare 65 Plus Advantage Plan offered in partnership with United Healthcare. United Healthcare has expansive benefits offered across the country and includes a prescription drug plan. The plan offers a retiree-focused wellness program. There is a dedicated United Healthcare team for all SchoolCare retirees to help answer your questions. The cost for this plan is $398 per person per month through December 31st, 2025. Under this plan, Medicare Parts A and B are secondary. Now let's look at the coverage of how the plan works. Your Medicare Advantage plan with United Healthcare and SchoolCare will cover all the Part A benefits: inpatient hospital, skilled nursing, and home health, all the Part B benefits, doctor office visits, outpatient care, and labs, Part D, prescription drug coverage, as well as offer additional benefits and programs beyond original Medicare. You will continue to retain all the rights and privileges of Medicare, but your benefits and claims will be processed by United Healthcare, and there are no deductibles on the plan and no out-of-pocket maximum. The SchoolCare 65 Plus Medicare Advantage Plan includes Part D prescription drug coverage. The plan also includes coverage for all Medicare covered services, as well as an eyewear benefit, hearing aid allowance, and numerous other benefits. There is no referral needed to see a specialist. Your Medicare Advantage plan is considered a national PPO plan. What that means to you is you can utilize doctors, clinics, and hospitals across the United States and the U.S. territories for the same cost share, whether the provider is in the United Healthcare provider network or is out of network, as long as they participate in Medicare. All medical services, both in and out of network, have $0 copays. This includes your primary care visits, specialists, urgent care and emergency rooms, inpatient stays, etc. And there is no copay for a virtual medical visit. Finally, please note that emergency room and urgent care services are covered worldwide. The plan also covers preventative screens with no copay. Some of the preventative services that are covered by the plan are an annual physical, an annual wellness visit, immunizations, and cancer screenings. The SchoolCare 65 Plus Advantage Plan, as indicated early in the presentation, includes additional features and benefits. The vision benefit includes a routine eye exam every 12 months and a $100 allowance towards eyeglasses or contacts every 12 months. The program uses United Healthcare Provider Network for exams. The hearing benefit includes a $500 hearing aid allowance every 3 years when you use a United Healthcare hearing provider. This includes both prescription and non-prescription hearing aids. There are hundreds of styles of brands to choose from, and savings of 50 to 80% when you use a United Healthcare provider. To get started, visit the uhchearing.com/retiree website or call 1-866-445-2071 before going to your local provider. Continuing with additional features and benefits. The SchoolCare 65 Plus Advantage Plan includes a personal emergency response system, offering your link to greater peace of mind and independence. It is a wearable pendant or bracelet by Lifeline, which will alert others if you require assistance, just by pressing a button. The program is included with your coverage from United Healthcare at no additional cost. United Healthcare House Calls brings a healthcare practitioner to your home to perform a head-to-toe exam, review your health history and current medications with you, help identify health and safety concerns, and provide health education. The visits last up to an hour, and the results are provided to you to discuss with your doctor. The plan also provides support and assistance on demand with two options. These include 24/7 nurse support to speak with a registered nurse and virtual care for both medical and behavioral health. The 24/7 nurse support can help you choose the best option for your care, assist in finding a doctor or hospital, and help with understanding your diagnosis and treatment options. Virtual care is available for minor health concerns, including allergies, colds and coughs, fever, flu, and other illnesses. Behavioral health visits are also available virtually to help with depression, trauma and loss, medication management, or addiction. There is no cost for either program. You also have retiree-focused wellness benefits. There are several ways to keep fit and healthy. Renew Active offers a free gym membership at a participating gym of your choice, thousands of on-demand workout videos, social activities, wellness classes, a brain health program, and much more. And last but not least, there's Let's Move, a program to help you eat well, get fit, find support for your mental health, and connect with others through local and online events, classes, and volunteering. Now we'll review the prescription drug benefit. First, it may be helpful to understand the stages of Medicare-based drug coverage. In the initial coverage stage, you will pay a copay or coinsurance for prescriptions, and the plan will cover the remaining cost. With our United Healthcare Advantage plan, the annual deductible is $0. You will pay up to $2,000 in prescription copays or coinsurance as outlined on the next slide. Once the total out-of-pocket cost for prescriptions reaches $2,000, you will enter the catastrophic coverage stage. Due to the Inflation Reduction Act, the out-of-pocket maximum has been reduced from $8,000 to $2,000 beginning January 1st, 2025. So if you reach the catastrophic coverage stage, you will not pay any additional out-of-pocket costs for prescriptions for the remainder of the year. Your copays will remain the same or be reduced to $0 for the rest of the planned year. Let's further explore the specifics of the SchoolCare 65 Plus Advantage prescription drug coverage. Covered drugs are organized in tiers. Each tier has a different cost associated with it. Tier 1 consists of preferred generic drugs and are covered at a $10 copay for a 31-day supply, or $15 copay for a 90-day mail order supply through Optum Rx mail order. Tier 2 consists of preferred brand drugs and are covered at a $30 copay for a 31-day supply, or $45 copay for a 90-day mail order supply through Optum Rx mail order. Tier 3 consists of non-preferred drugs and are covered at a $40 copay for a 31-day supply, or $60 copay for a 90-day mail order supply through Optum Rx mail order. Tier 4 consists of specialty drugs and are covered at a 12% coinsurance for a 31-day supply, or 12% coinsurance for a 90-day mail order supply through Optum Rx mail order. These costs reflect the amount you would pay during the initial coverage stage. When and if you reach the catastrophic coverage stage, as previously explained, you would pay $0 for the rest of the year. Now the details of the SchoolCare 65 Plus traditional Medicare supplement plan. Medicare Parts A and B would be your primary insurance. SchoolCare 65 Plus traditional is secondary coverage and supplements Medicare. This plan is a Medicare Plan G and is provided in partnership with United American. The monthly cost for the SchoolCare 65 Plus traditional plan is $192 per person per month. Please note, this plan does not include a Part D prescription drug plan. Now for some specifics on the coverage components of the SchoolCare 65 Plus traditional supplement plan. As you can see from the last column on the right, there are relatively low costs to be incurred if you're on this plan, noting that Medicare Part A coverage for inpatient care is comprehensive. You can expect to have no out-of-pocket costs for Part A services, with the exception of skilled nursing care beyond 100 days and hospice care for outpatient drugs and inpatient respite care. When it comes to Part B services, or outpatient care, including blood transfusions, lab services, and durable medical equipment, you can expect to pay the Part B deductible, which is $257 for 2025. This is an annual deductible. It is reflected multiple times on this chart because it can be made up of billing for more than one service shown in the chart, but never exceeding $257 total in 2025. And lastly, foreign travel. As you can see, Medicare does not provide coverage for foreign travel. The SchoolCare 65 Plus Traditional Plan G includes a foreign travel rider. If you incur expenses traveling outside the United States, you will pay the first $250 deductible, then you pay 20% of the charges, while the plan pays 80% up to a maximum of $50,000 payment per lifetime. Any cost over that amount would be the responsibility of the patient. Let's recap the SchoolCare 65 Plus plan options by reviewing the two plans. The first column provides a description. Please note the differences in the amount you can expect to pay in the two columns on the right. The SchoolCare 65 Plus Advantage plan through United Healthcare is highlighted in blue. This plan option is the most comprehensive and provides enhancements such as no requirement for a prior hospital stay before skilled nursing care, podiatry, hearing aids, unlimited foreign travel benefit, and prescription drug coverage. In addition, you should note that there is no cost to you for services subject to the Medicare Part B deductible. The SchoolCare 65 Plus Traditional Plan through United American is highlighted in green. This is a Medicare Plan G. Retirees enrolled in this plan are financially responsible for the annual Medicare Part B deductible of $257 in 2025. In addition, foreign travel coverage is limited to emergency care only and has a $50,000 lifetime max benefit, as well as a $250 deductible and then 20% coinsurance dynamic for any claims. There is no prescription drug coverage associated with this plan. Retirees who enroll in this plan should also enroll in a Medicare Part D prescription plan at medicare.gov. Here's a summary of the enhanced benefits of the SchoolCare 65 Plus Advantage Plan. Coverage includes annual routine physical and hearing and eye exams at no cost. The Advantage Plan pays $100 towards eyeglasses or contact lenses every 12 months. The Healthy at Home program provides 28 meals, 12 rides, and 6 hours of in-home personal care up to 30 days following inpatient stays. A personal emergency response system through Lifeline is included, as well as Renew Active. Renew Active Fitness program pays for a standard membership at a participating gym location. The premium cost for our SchoolCare 65 Plus Advantage Plan is $398 per person per month. The SchoolCare 65 Plus Traditional Supplement Plan is $192 per person per month. We know you have many options for retiree coverage, so we'd like to cover some reasons for why you might choose to enroll in one of SchoolCare 65 Plus plans. First, SchoolCare offers comprehensive coverage at competitive group rates, rather than individual age-based rates you might pay elsewhere. The SchoolCare 65 Plus Advantage Plan offers prescription drug coverage that exceeds Medicare Part D standards of credibility. The prescription coverage has a broad formulary covering many medications excluded by Medicare Part D, along with a nationwide pharmacy network. We also hope you find it valuable that you can turn to SchoolCare staff whenever you have questions or concerns. We pride ourselves on being accessible and knowledgeable in our programs so we can provide you with individualized support and service. Finally, enrollment in all SchoolCare plans include identity fraud reimbursement coverage. Hopefully you will never need this coverage, but it sure can be helpful if you ever find yourself needing this benefit. When enrolling on either of the SchoolCare 65 Plus plans, you will need to provide a copy of your Medicare card showing both coverage for Medicare Parts A and B. Upon completion of the form, it should be signed, dated, and returned to SchoolCare at least 15 days prior to your requested effective date. SchoolCare offers a variety of payment options. If you receive a New Hampshire Retirement System pension, then you can authorize the monthly cost to be deducted from the monthly pension by filling out the NHRS annuity deduction form. You can also have the option to pay your monthly invoice with a check or set up recurring payments from your credit card or ACH from a checking account. There are several resources available to support you in making coverage decisions. First, you certainly have us here at SchoolCare. You can visit our website for plan information at www.schoolcare.org/medical-SC65. You can also call us at 603-836-5031. For benefit information, press 3, or for eligibility and enrollment information, press 1. United Healthcare can be reached by calling 866-207-2262 or by visiting their website for the SchoolCare 65 Plus plan at www.retiree.uhc.com/SchoolCare. United American can be reached by calling 800-331-2512 or by visiting their website at www.unitedamerican.com. Medicare can be reached by calling 800-633-4227 or by visiting their website at www.medicare.gov. Finally, ServiceLink can also be a helpful resource in making a decision about your coverage options. They can be reached by calling 866-634-9412 or by visiting their website at www.servicelink.nh.gov. Thank you so much for taking the time to learn more about the SchoolCare 65 Plus retiree health benefit plans. Please feel free to call our office at 603-836-5031 if you have any questions. Take good care.